Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got one of my classic favorites for degenerative disc disease of the lower back that I use with patients and students alike. It's the horizontal squat. Hope you enjoy it. So we teach the horizontal squat to many of our patients, our students, and it's a big part of the rehabilitative programs here on the Pain Free and Fit websites. When we have our programs, whether it's for degenerative disc disease, spondylolisthesis, or other low back conditions, we invariably include some horizontal squatting because it allows us to engage in the most common motion, which is bending forward in a correct and safe way. Most people with degenerative disc disease, if they bend forward and have tight hips and move too much from the lower back, which is common, they're going to compress or flex the front part of their spines where those degenerative discs are, and that compression actually irritates their lower back pain. So it's key when we bend forward that we train ourselves to bend more from the hip joints, the ball and socket of where the leg attaches to the pelvis, while we keep a neutral spine or a spinal position that's pain-free. Now, if you've not yet done so, I would invite you to go to either the Pain Free and Fit or the Posture Size websites. There's a free body analysis there to learn what your unique RPIs are, or corrections, reverse posture isometrics, of your unique body posture issues and mechanical issues. Learning how to get yourself in a neutral spine. That's beyond the length that we have right now in this video, but it's shown elsewhere on our channel here in other videos talking about neutral spine stability, and it's throughout all of our programs on the Pain Free and Fit self-help series of programs available on the Pain Free and Fit website. Once you get yourself into that neutral spine position, the horizontal squat is performed by taking a wider stance than usual, a comfortable amount. Remember, when you take a wide stance, more than having your feet directly underneath the center of your thighs, you're going to angle your feet outwards. You're going to engage your neutral spine. That may be a little bit of tail up or tail under, one hip down, the other hip down, a little rotation with your pelvis to one side or rib cage, a little leaning one way with your rib cage. You may have to engage your multifidi muscles in your back or have a more balanced effect on your transverse abdominis and internal obliques. That, again, is explained in detail in the different chapters of the Pain Free and Fit self-help series books on low back pain, as well as to some degree on our website in that free body analysis. So once you engage that neutral spine, you're simply going to make sure that that spine in your lower back is not moving from that position that you've set it in, that neutral spine, so it's in a safe zone. And you're going to bend forward by sitting back and allowing the bend from your upper body, from my tailbone right through my head, if you notice, is bending forward from my hip joint. That's a good squatting motion. If you notice, my knees really aren't traveling forward with that. All the emphasis is on the hip joint. My knees are bending but not moving forward. If I have a tendency to have an anterior hip malposition or an anterior femoral glide syndrome, again, you'll learn about that in your body analysis. You need to focus on a backwards tension of the leg bone in the hip socket on that side. If you have a tendency to turn one leg out more than another, external hip rotation, which of course creates hip hiking and torso side leaning, compression on that side of your degenerative disc, you'll want to make sure that you check that you're not turning out more on that side than the other, but that your feet are both pointing at the same angle. So once you have this, you're going to descend as far as you can, emphasizing that neutral spine, no motion in the spine, all in the hip socket. And if you can get yourself down to almost horizontal or horizontal, you're going to put your arms out to the side with the thumbs up, squeeze your shoulder blades together, and hold. So this is both stretching the hip complex to induce hip flexion or hip motion, which is lacking in many degenerative disc cases, and it's strengthening the extensor muscles, the erector spinae, the glutes, the hamstrings, the latissimus muscles that run from your shoulder to your back. Your multifidi muscles are contracting here, as long as you're making sure that lower abdomen tension is in and you feel a little bulging out on the sides of your vertebrae. Again, we have another video on multifidus training here on the channel. If you subscribe, you can view that video as well. And you're going to hold that position for a comfortable amount of time. It could be 10 seconds, you could build up to 15, 30 seconds, and then squeeze the buttocks together to come out. So as opposed to doing repetitions up and down, which is another style of training with sumo squats, we're basically taking the lowest position trying to get our bodies as horizontal to the floor as comfortable. There'll be a little bit of a pitch up. You won't be particularly horizontal, and you're just going to hold that. And you can do this anywhere from 3 reps to 5 reps. And afterwards, you're going to notice that your hips are going to be more flexible. If you go to bend forward, you'll notice your hips are much freer. You'll neurologically increase that coordination of low back to hip so that the lower back becomes more stable, the hips become more mobile, and you'll be freeing yourself from excessive flexion or bending forward on that lower back, freeing yourself from degenerative disc pain. If you like what we're teaching here in this video, please subscribe to our channel. We got a lot more great exercises on degenerative disc disease. We have a whole program that goes over this exercise and others on our degenerative disc fast track program available at the Pain Free and Fit website. If you have any questions or comments, please leave them. They seed the ideas for me to do future videos. And I hope this exercise helps you with your degenerative disc disease.